Here are 5 physio facts about hip arthritis. Fact number 1. Hip arthritis is not a wear and tear condition. Your hip joints are not like car parts that wear out. In fact, your joints are part of a living organism which can adapt and heal. Your hips will not wear and tear. In fact, they will wear and repair. When we walk, squat, run, or jump, or are generally more physically active, our joints, muscles, and connective tissue get stronger and more resilient. You just need to find an appropriate starting point and build up from there.
Fact 2. Scans do not tell you if you have hip arthritis. In fact, if we take a bunch of people who are asymptomatic, meaning they have no symptoms at all in their hips, and we scan those people, what we'll find is that a large percentage of them will have findings like degeneration, labral tears, and cartilage thinning. Therefore, scans do not give us the full picture. What's more important than your scan findings is how you are handling your day-to-day activities. It's good to remember that your symptoms can significantly improve without seeing any changes on the imaging.
Fact 3. Exercise is an evidence-based treatment for hip arthritis. We all know that exercise is good for us, but it is just as good for someone with hip arthritis. In particular, land-based exercise such as resistance training and walking are great options as they make you better prepared for all the movements you do in your day-to-day life.
Fact 4. Pain with movement does not mean that you're causing harm to your joint. In the vast majority of cases, an increase in pain in your hip is a reflection of the sensitivity in the structures around that area and not an increase in the amount of damage. Think of it like this. Have you ever been sunburnt? That evening, getting into a warm shower can be excruciatingly painful, but that warm water is not damaging the skin. It's just irritating an already sensitive area. The same thing can happen with your hip. It can become sensitive to certain movements. But finding an appropriate starting point can really help to build up your confidence. For example, starting with a sit to stand might be a better option than a squat. You just need to find an appropriate starting point. Start low and go slow.
Fact 5. Ultrasound, acupuncture, and massage aren't effective treatments for your hip osteoarthritis. Whilst these things might make you feel better in the short term, they aren't doing anything to build muscle strength and improve the tolerance of your joint. Instead, you should focus on evidence-based treatments. So things like weight loss if you're overweight, health education, which you're doing right now, and land-based exercise, which we just talked about. And if you want a comprehensive video all about hip arthritis, then check out this one.